Namaste. When your knees are worn out or injured, you may experience extreme pain performing even the simplest of the simplest tasks. It could be walking, sitting down, or even getting up from a chair. In such cases, you need a specialist care, and during this special care, our doctor may advise you for a total knee replacement. During this surgery, the doctor replaces the damaged bones and cartilage with metal or plastic to increase the stability, mobility, and the range of motion to reduce pain and better movement. And to let us know more about this procedure, we have with us our expert, Dr. Vijay K. Reddy, Senior Consultant Orthopedic Surgeon at Apollo Hospital's Greams Road, Chennai. Namaste, Doctor, and welcome to the Facebook Live session.
Namaste.
To begin with, Doctor, what is total knee replacement surgery and who is it advised for?
Total knee replacement, also called as a total knee resurfacing surgery. What exactly happens in total knee replacement is a damaged knee bone ends will be replaced with the metal and plastic. In the knee joint, there is the femur and the tibia bone. In arthritis, these two bone ends will be damaged. In a knee replacement, what we exactly do is we cut the surface of this bone and we replace with the implants. So you won't have pain. You will be walking without any discomfort. Who will need this knee replacement? Usually mild to moderate, grade 1 and 2 will usually be given some medication physio. Grade 3 to 4, which is moderate to severe, where there is a bone to bone arthritis, that's where total knee replacement is a game changer for their lifestyle.
So, why is a total knee replacement surgery performed, Doctor? Is it only in the case of a fall or weak bone? Why is it performed?
So, majorly what we are seeing now, replacements in the knee joint is the osteoarthritis, where is a age-related degenerative arthritis in the knee joint. As a knee comes very good for 50 good years, afterwards, because of so many conditions like obesity, diabetes, and previous injuries, your knee may have a wear and tear and slowly develop arthritis. So you have a grade 3-4, which is moderate to severe arthritis, where there is no cartilage, completely damaged meniscus, there is a bone to bone rubbing in the joint. That's where knee replacement is advised to undergo.
So, how do doctors decide if a person actually needs a total knee replacement?
So usually people do come to us when they all try this conservative medication, like taking glucosamine tablets, using some braces, taking some visco supplements, and also some stem cell injections. Nowadays they are taking a lot of them, and they do a good amount of physio, lot of restrictions, and then they come to a point where they can't bear, they can't move their knee joint, they can't bend their knee joint, they are in a difficulty to do their day-to-day activities. That's where what we do see in our practice, they do come to us for help to get better their knee. So that's where we see the patient with a complete osteoarthritis or arthritis due to rheumatoid arthritis. We do suggest them replacement surgery for knee joint.
So, while performing a total knee replacement, what are the parts of the knee that are replaced in during the surgery, Doctor? Can you elaborate that for us?
As I said, knee joint contains the femur bone and the leg bone, which is tibia. So what happens in the joint is they have a complete damage of the cartilage. So what we do in a replacement is that we remove the damaged part of the bone and we fix the implants in the femur, fix the implant in the tibia, that is a leg bone, and we also fix the spacer in between, which is a plastic, and we give the artificial joint to the knee joint.
So, as a layman, when should I approach an orthopedic specialist? What are the symptoms that I should be aware of, Doctor?
When you have a pain in the knee joint, when you have a deformity in the knee joint, a lot of people do have a swelling also in the knee joint, restriction of movement in the knee joint. When you are not able to get up comfortably, when you are not able to walk comfortably, when you are not able to step up or step down on the stairs, when you are not able to do just walking towards to your bathroom or not going to your even the dining hall to have your lunch or dinner, definitely there is something going on with your knee joint very, very badly. That is the time where we do get the patients complaining of all these things, of day-to-day daily activities are compromised. That is the time when they knock us for help.
So, what are the outcomes of total knee replacement surgery, doctor? How long does it take for a person or a patient to recover from the surgery?
So if you see, since last 40 years, we have been doing total knee replacements in India. Gradually, the numbers are increasing. If you see, last year we have done close to 4.5 lakh replacements in India. If you see in US, 10 lakhs per year it's happening. We are growing in size. When we grow in size, we get a lot of information in terms of success, outcome, everything. So at the moment, we do have a success rate of 90 to 92% approximately with the conventional methods. So what happens in a knee replacement post? So usually the very next day of the surgery, we will be mobilize the patient. Patient will be walking with a walker. The second day, we will be making the patient to walk on the stairs, and we will be also teaching the toilet needs. And the third day of the surgery, we will be discharging the patient. Followed which patient will be walking at the home with a walker. The 14th day, we will remove the sutures. Usually on the third week of the post-surgery, patient will be walking without any walker. He'll be walking on his own without any support. After 1 month, so patient can join the work if at all they are working people. If you want to play tennis, you can go back to the court after 6 weeks. So usually by and large 4 weeks post surgery, one can do regular work at home, cooking, walking, outdoor, joining the work. All these things can happen in 1 month's time post surgery.
Do you see an increase in the number of total knee replacement surgeries being performed, doctor, like what you mentioned? And if that's the case, why are there so many? Is there an increase?
There is a huge increase in India at the moment. One is understanding about the need of the surgery, which was not there before. Now people do come because they have seen a lot of successful stories near them, in their relatives, in their friend groups. So they are approaching now a lot of orthopedic surgeons and asking for this surgery for betterment of the mobility. Yeah, if you see last year, as I said, 4.5 lakh replacements happened in India. That shows the success rate of the surgery per se. So it has a very great successful rate, and people are coming forward to undergo this surgery for betterment of the knee joint.
Doctor, one major breakthrough in the field of orthopedics is the robotic knee replacement surgery. Could you elaborate a bit about it?
So robotics in India, we have seen since and using since last 2 years, and the one what we are performing is a striker Mako, which is very most advanced robotic system. See, we do operate still on conventional knee replacement surgeries. We have a very good outcomes. As I said, with the robotic surgeries, we are seeing little more better outcomes than the conventional surgeries. In a conventional surgeries, what exactly happen? We just see the patient clinically, we examine the knee joint, we do take the X-ray. Intraoperatively, we cut the femur by using intramedullary jig and the tibia by using an extramedullary jig, and then we place the implants. What happens in a robotic knee replacement surgery? We do perform a CT scan of the knee joint, 3D CT scan, followed which we get the complete data into the robot system, where robot analyze the knee joint. Intraoperatively, we have a special spaces organized in the knee joint. These spaces will give a complete information to the robot, and robot will give us a clear roadmap to how much to cut, how much gap it requires in that particular knee joint, and what would be the appropriate implant sizes, what knee looks like in 30 degrees flexion, 60 degrees, 90 degrees, 120 degrees. So these are all a great add-on to the knee joint. Each finger is different, each joint is a different, each knee is a different. So that's where robot has a great advantage to give information, to give the stability, and to give also the perfect placement of the implants. So hence the outcomes will differ. The outcomes so far what we are seeing is a very good outcomes with the robotic knee replacement.
You explained to us how different is it from traditional surgery, doctor. So how do you determine who undergoes a robotic knee replacement surgery vis-a-vis traditional knee replacement surgery?
Robotic knee replacements surgeries are advised anyone who has a grade 3 to 4 arthritis in the knee joint. So there is no big no to the robotic knee replacement surgery for the patients. Anyone who is eligible for conventional knee replacements can undergo robotic knee replacement surgery. It's only the cost which little bit add on to the robotic knee replacement surgery when we do.
Doctor, are there any other technological advancements in the field of orthopedics? If yes, what are they?
So at the moment, robotic system in the joint replacement is the big thing which has come since last 2 years. The one what we are looking at is AI in coming days. That's artificial intelligence. Still, a lot of research is happening in orthopedics, and I think time will tell us where, when it will be coming, and what are the uses and what are the pros and cons of the particular technology.
Is recovery quicker in robotic surgery, doctor? And how quickly can a patient get discharged and get back to normal life?
It's a very good question. Well done conventional replacement and robotic replacements have a good amount of outcomes. The robotic replacement surgeries definitely have a great outcome because we have a complete pre-op plan, how much we are going to cut in the femur, how much we are going to cut in the tibia, what is the gap balance, what is the stability of the joint, how the implants are going to sit. We have a complete plan, and hence the outcomes of the robotic surgery will be definitely better over the conventional surgery. Usually, with the robotic knee replacements, in a 2 weeks' time, they will be walking without any knee braces or any knee supports, as well as any walkers. They will be walking on their own. So they will be bending the knee very next day. They'll be doing all the regular activities in a 2 to 3 weeks' time.
How is the post care that one needs to keep in mind with respect to robotic knee replacement surgery, doctor?
See, the very important thing for any replacement is the pre-op exercises. Pre-op good exercises will definitely make post-op very easy. So one should do the pre-op good strengthening exercise of the quads. Once you do that, post-op becomes very, very effective. Coming to the robotic knee replacement, we do a tailored passion knee replacement surgery. We don't much release the tissues. We cut to the particular knee problems correctly. We cut to the damaged bone. The recovery is very faster. So they'll be doing regular activities on the second week of the post surgery.
We'll take some questions from our viewers, doctor. I'm a 20-year-old male with an injured knee due to playing high contact sports. Now I'm experiencing excruciating pain. Will I need a total knee replacement surgery? Kindly advise.
I absolutely don't think you require a total knee replacement surgery. You are very young, you are only 20 years, and it's a sports injury. You need to definitely, you need to see an orthopedic surgeon. One need to see your x-ray or probably MRI scan and see what's happening into your knee joint. Usually in a young people, it's mostly a ligament injury or a cartilage injury or a meniscal injury, and this will be addressed through the arthroscopy, which is a keyhole. I don't think you will be requiring a total knee replacement for you.
Hello, doctor. My family has a history of arthritis, and I have heard that degenerative diseases cause knee damage. If I have arthritis, or if I would have arthritis, do I need a total knee replacement surgery in future?
It depends on what grade of arthritis you have, and according to that, the treatment varies right from the medication to the surgery. If your parents have arthritis, you are likely to get arthritis, definitely more common than others. But only one thing you must remember and address is the body weight. If you try to put more body weight on your knee joint, then you are bound to get arthritis faster. What happens if your knee joint is a weight bearing joint? Shoulder, elbow, wrist are weight sharing joints. Hip, knee, ankle are weight bearing joints. The more weight you put, the more weight will damage the weight bearing joint like a knee joint. So if you have a parents who already have arthritis, then you must surely maintain your body weight, you maintain your BMI, and make sure you do a good strengthening exercise for your lower limbs.
Hello, doctor. I'm going in for a total knee replacement surgery this month. I wanted to understand how durable is this metal or plastic plate is, and what would be the longevity of it.
See, now we have a lot of new technology has come in India. See, whatever instrumentations, implants are used in the one of the best centers in the world. Maybe it's a Europe or an America. Everything are available in India. So we get everything here. That is one thing what I wanted to ensure and tell you guys. It's everything available in India at the moment, because we are doing about close to 4,50,000 joints per year. This is a very big number. Well done knee replacement with good implants will come for usually 25 to 30 years. If we do it with a robotic knee replacement surgery, then the outcome will be better because placement of the implants will be perfect. So we can see the implant length coming from 30 years to probably 35 years. Research are coming in this process. We are looking at good outcome with the robotic knee replacement surgeries.
My grandfather had undergone a total knee replacement surgery about 10 years ago. Does he have to do it again?
If your grandfather doesn't have any problem, if the x-rays are looking good, then I really don't think he require any other further surgery. All he needs is strengthening his knee joint.
Can I get a total knee replacement surgery for both my knees simultaneously? If yes, what is the recovery period?
Very good question. So unilateral and bilateral. Unilateral means doing only the single side replacement surgery. Bilateral is doing both knee replacement surgery. So, who requires a bilateral knee replacement? When we do a bilateral knee replacement, anybody who has a both knee issues, there is a damage in the both knee which is moderate to severe, who are fit physically, who doesn't have any comorbids, who are young comparatively, meaning like 50 to 60. They don't have any diabetes, they don't have any hypertension, they don't have any thyroid problems, they are not very obese. Those are the perfect people to undergo both knee replacement at a single admission. When we do a single knee replacement is when they are very obese, when they are not able to walk little bit distance, when they have a diabetes very high, hypertension, all these things we consider, and in those type of cases we do give gap in between their replacement surgeries at least 3 months.
What would be your message to our viewers watching the live session today, doctor?
My advice to the youngsters and my advice to the elders. My advice to the youngsters, if you have any problem in the knee joint, address them prior, meet orthopedic surgeon, clear them, because a lot of injuries what happens at the younger age can be cleared completely nowadays because of the technology, and completely avoid your arthritis in future dates. Keep the joints mobile, keep the joints pain free. In elders, make sure that you maintain the body weight. You put on more weight, the weight bearing joint like knee will destroy faster. So maintain your body weight and don't sit in a single position more than 30 minutes. That is 90 degrees. Make sure that you get up every 20 minutes, 30 minutes once. Come back and sit. Do a strengthening exercise for the knee joint. Cycling and swimming are the best exercise for the knee joint. If you have arthritis, don't try to sit in a low sitting chairs for a long duration. Assuming you're traveling in a car in a back seat, don't travel more than 1 hour in the same position. Make sure that you get out of the car for 5 minutes, stretch your knees, and then go back and sit if you have a knee problem. Strengthen the knee on a regular basis to avoid the arthritis in your future dates.
Doctor, sorry, one last question. Who is more prone to undergoing a knee replacement surgery? Is it gender specific? Are women more prone to it?
We are seeing in India more women. That's because of different aspects. Because they do sit a lot down on the floor. They do a lot of activities on the floor, like praying, eating on the floor, etc. But yes, we do see a lot of women in India who undergo knee replacement surgery.
Thank you so much, Doctor. That was a very interesting session on all we needed to know about knee replacement surgery. For appointments with Dr. Vijay K. Reddy, Senior Consultant Orthopedic Surgeon at Apollo Hospitals, Greams Road, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, Doctor.
Thank you.
Thank you, viewers.